Melidia Cluo is a news assignment manager for WTVC in Chattanooga, Tennessee. She has always been a hard worker, but even as a child, she knew something about her inability to concentrate and focus just wasn't right.
Looking back, I was terrible on tests. I have a fairly high IQ, but when it came time to sit down at the desk and do the multiple choice, I would freeze.
But it wasn't until she was an adult that her condition was actually diagnosed. Attention Deficit Hyperactivity Disorder, or ADHD, a disorder that can be difficult to identify.
It doesn't have always an exact same appearance in everybody. Everybody's ADD is unique.
The problem is, the symptoms of ADHD in adults can be very subtle and confused with other health conditions like depression or effects from head traumas. Symptoms include attention difficulties, inability to focus, restlessness, unstable mood, disorganization, a short temper, reduced stress tolerance, and impulsivity.
I would begin to clean the house, and I'd open a drawer, clean out the drawer. There'd be something in the drawer, say a roll of film. Oh, I need to take this to Walmart and get this film developed. And then the pictures would be great, and I'd think, you know, I really need to scrapbook these. And I'd pull out all my scrapbook stuff, and then the phone would ring, and someone would want to go to a movie, and I'd go, okay, I'll go to a movie. I'd be gone, and my husband would walk in, and that drawer would be open with all the stuff spilled out. Scrapbooking stuff would be all over the house. And the last time he had talked to me, I was going to spend the day cleaning.
People sometimes think that ADHD is not really a real diagnosis, that it's a way that people, particularly adults, explain away their failures.
It's estimated that 5 to 10% of children across the world have ADHD, and in about 80% of the cases, it's a hereditary condition. Often the most obvious clue that adults have ADHD is their children have it.
So we're interviewing the parents and the siblings of our children that came to treatment in my program, and it was very clear that a sizable number of the parents of the children that we saw in our clinic had the same condition.
Regardless of age, the diagnosis of ADHD is accomplished through history. There are no tests per se that make the diagnosis.
Melidia's correct diagnosis came after the condition threatened her marriage.
My husband basically said to me, if you don't go and get some help, I will divorce you, because I was so irritable and impulsive. I couldn't rein in my tongue, and a thought would fly through my head and it was out of my mouth before I had time to say, stop, don't say that.
Once diagnosed, adult ADHD, like the childhood version, can be effectively treated, but it may take a while for mental health professionals to find the proper marriage of therapies that work best for individual patients. A combination of medicine and psychotherapy may be what's ultimately needed to bring the condition under control. It took both time and patience for Melidia's ADHD to be properly diagnosed and treated, but today, she's in control of her life.
You're using ADHD as an excuse for everything that's wrong. I don't see it as an excuse. I see it as an explanation for why I'm prone to do the things I do, and then it's up to me to change that behavior pattern.